নমস্কার, হেলথ প্লাস অনুষ্ঠানে আপনাদের স্বাগত। দক্ষিণ ভারতের অন্যতম শীর্ষ মাল্টি সুপার স্পেশালিটি হাসপাতাল যশোদা হসপিটালস হায়দ্রাবাদ 1989 সাল থেকে আধুনিক চিকিৎসা প্রযুক্তি এবং মানবিক যত্নের সমন্বয়ে কোটি কোটি মানুষের জীবনে এনে দিয়েছে নতুন দিশা। সোমাজিগুড়া, সেকেন্দ্রাবাদ, মালাকপেট এবং হাইটেক সিটিতে 4টি অত্যাধুনিক ইউনিটে রয়েছে প্রায় 4000 বেড, যেখানে চিকিৎসায় নিয়োজিত বিশ্বমানের চিকিৎসকের দল। ক্যান্সার কেয়ার, কার্ডিয়াক, নিউরো, আর্থো, ট্রান্সপ্লান্ট সার্ভিসেসের সঙ্গে রয়েছে অত্যাধুনিক এমআর, লিনেক এবং রোবোটিক সার্জারির সুবিধাও। যশোদা হসপিটালস হায়দ্রাবাদ, আপনার সুস্থতার বিশ্বাস, আপনার জীবনের নতুন অধ্যায়। এবং আজকে অবশ্যই আমাদের আলোচনার বিষয় এমন একটি গুরুত্বপূর্ণ জিনিস যেটার সঙ্গে হয়তো আমরা প্রত্যেকটা দিন পরিচিত হই, আবার অনেকে হয়তো বিষয়টা সম্পর্কে জানেনই না। তাই সেই সমস্ত বিষয় ধারণা দেওয়ার জন্য আজকে আমাদের আলোচনার বিষয় মোয়ামোয়ার ডিজিজ, প্রোগ্রেসিভ ব্রেন ডিসঅর্ডার। এবং এই বিষয় নিয়ে আমরা কথা বলার জন্য স্টুডিওতে আমাদের সঙ্গে পেয়ে গিয়েছি চিকিৎসক ডক্টর বি জয়নন্দ সুধীর, সিনিयर कंसल्टेंट न्यूरोसर्जन, यशोदा हॉस्पिटल्स, मलकपेट, हैदराबाद, तेलंगाना। वेलकम टू द शो सर।
थैंक यू।
सबसे पहले मुझे आपसे ये पूछना है, ये जो मैंने बोला अभी मोया डिजीज, ये डिजीज क्या है, इसको कैसे आइडेंटिफाई करते हैं?
Moya disease is a very rare disorder, and of late its incidence is coming up in India. That is why we need to give more attention to this disease. The disease was first described in Japan and eastern China and is more common there. What happens in Moya disease is that the main blood vessels supplying the brain start closing off spontaneously. This results in stroke. The unusual feature of this stroke is that it affects children less than 15 years, and the second age group that is affected is around 40 to 50 years. Rarely we see it in other age groups between 20 to 40 as well as above 60. The common cause of stroke is atherosclerosis or the cholesterol deposition in the blood vessels, but in Moya, the reason is unknown. That is why we are bringing this disease to perspective to the national audience.
What are the symptoms of Moya disease?
As I said, the main symptoms of Moya disease is stroke. There are two types of stroke. One is ischemic stroke, where the blood vessels, the narrowing of the blood vessels causes decrease in blood supply to the brain, and this shuts down the function of the brain. So this can present with decrease in movement of the limbs or difficulty in speech and sometimes problems with vision. The second type of stroke is hemorrhagic, that is there occurs bleeding into the brain, and this causes stunning of the brain or damage to the brain tissue, and again the symptoms can remain the same, that is limb weakness or speech difficulty or even visual problems. Now in Moya disease, both these types of strokes can occur, that is the ischemic stroke because of the decreased blood supply or hemorrhagic stroke because of the bleeding.
Is that disease common in India?
It was not common in India, but over the last decade we have seen that there is an increasing incidence of these cases. Particularly in certain regions of India like West Bengal and Gujarat, these cases are coming much more into attention. Most of my patients come from West Bengal, and that is why we have placed this interview in Kolkata, West Bengal.
वेस्ट बंगाल के पीपल को बहुत ज़्यादा इससे समझ के चलना चाहिए क्या मोया डिजीज से?
They should be aware of this disease. The main issue with the diagnosis is that because the disease is rare, even doctors fail to notice that it is Moya. And when it affects very small children, when they have transient weakness of the limbs, that is minor strokes, they come into clinical attention, but the doctors fail to realize that it is Moya. They think that the child is acting out, doesn't want to go to school, and hence they may ignore these symptoms. But when these symptoms become more and more frequent, they may suffer a major stroke and debilitating deficits. So they may become paralyzed for life, they may lose their speech, they may lose their vision. That is why we have to take more serious awareness of this disease into the community.
What is the cause of this disease?
So far, there is no known cause for the disease.
Okay.
But so many causes have been attributed, as even infections. Patients may present with fever during these episodes of stroke. Sometimes we find patients who have been radiated for tumors developing these kind of stroke. And over 36 genetic syndromes have been associated with Moya. So the actual cause of Moya is not particularly known. However, around 2 years back, we published an article we found that the global geographical prevalence of this disease is in parallel with high arsenic in the groundwater. In India also, West Bengal and the neighboring country of Bangladesh is highly affected by high arsenic levels in the groundwater. And this association prompts us to think that arsenic could be a cause for moya disease.
अगर किसी को पता नहीं चलता कि उस मोया डिजीज उसके अंदर है, अगर ठीक तरह से ट्रीटमेंट नहीं किया गया तो क्या हो सकता है?
As I said, this disease initially it gives some warnings.
Okay.
Sometimes they can develop transient strokes. The strokes may recur within a few hours, and very rarely it may be permanent strokes. So when you get a minor stroke itself, you have to pay necessary clinical attention. You have to take the patient to the doctor, thoroughly get evaluated with an angiogram to identify whether it is moya. Early diagnosis means that the patient can literally be treated effectively and prevent further future strokes.
इसको ट्रीटमेंट करने के बाद क्या क्या प्रिकॉशन लेना चाहिए पेशेंट को?
Right from diagnosis, patient has to take precautions. The main cause of stroke in moya disease is that because the blood vessels get narrow, the brain gets inadequate blood supply. So the patients, when they are dehydrated, it can be because of infection, fever, or not taking adequate water. Even children playing, strenuous activity, eating spicy food, or hyperventilating, deep breathing, all these can precipitate strokes. So they have to be cautious in not exerting themselves. To remain hydrated at all times, they should take adequate water. Forced hydration is the term that we have told. They have to deliberately take a lot of water, take all precautions to prevent dehydration. In case they develop fever or any other infections which require hospitalization, they should be administered IV fluids so that they remain hydrated all through this time. During surgery and even after surgery, doctors take adequate precautions to prevent dehydration. The surgery is not actually a cure for the illness. It is only a way to tide over the situation and prevent future strokes.
ये डिजीज क्यूरेबल है, मतलब पूरा क्योर हो सकता है इससे?
No, the disease is not curable. There is no medicine that can cure the disease. The main blood vessels to the brain actually shut off as a natural process of the disease. And as a treatment, what we do is called the brain bypass surgery. So you must have heard about cardiac bypass surgery. That is, if a blood vessel in the heart gets blocked, they do a bypass surgery. That is, an alternate blood vessel is used to bridge that block and supply blood to the heart tissue. Similarly, we do what is called a bypass surgery for the brain. And for this, we harvest the small blood vessels in the scalp, and these are connected to tiny blood vessels in the brain. So that is the procedure for revascularization. In patients who are not fit for this procedure, sometimes we do what is called the indirect revascularization. That is, we make a hole in the skull and we place tissues that are rich with blood supply, like the temporalis muscle over here, muscle that we use for chewing, or even the pericranium, the tissue that surrounds the bone, or the brain, the dura. So all these tissues are rich in blood supply, and these, when they are placed over the brain, by natural process, the brain stimulates the development of new blood vessels into the brain and thus prevents strokes. But the direct bypass gives an immediate benefit. The indirect revascularization takes some time for the new blood vessels to develop. It may take 3 to 6 months for these new blood vessels to develop.
मोया डिसीज के मेडिसिन से ट्रीटमेंट कर सकते हैं इनका?
There is no known medical cure for moya, but most neurologists prescribe the blood thinners like aspirin or cilostazol. These are not proven therapies because these are used for ischemic stroke, that is those strokes that occur in elderly individuals. So basically they prevent blood clotting. The blood thinners are actually not so effective in moya. The ideal treatment, as I said, is to remain completely hydrated and do the bypass surgery or the indirect revascularization surgery.
ब्रेन बाईपास सर्जरी क्या सबको होता है जो मोया डिजीज से इफेक्टेड है?
Brain bypass surgery. So brain bypass surgery is where we connect the small blood vessels in the scalp to the small blood vessels in the brain. So the size of these blood vessels are around 1 to 2 millimeters. We don't advocate bypass surgery for all patients. For very small children, even we have patients who are less than 2 years old who have been affected with moya. So the blood vessels are too tiny for us to do a direct bypass. And some patients may require bypass almost for the entire brain. So the bypass procedure takes almost 3 to 4 hours for one procedure to be completed. So if we contemplate 2 or 3 bypasses, the surgical risk of patients getting dehydrated during surgery also increases making them prone to develop strokes during the surgery. So what we advocate in such situations is indirect revascularization.
Are there any risk or complication during the brain bypass surgery?
Yes, the surgery is very tricky.
Okay.
It involves the connection of blood vessels very small, that is around 1 to 2 millimeters. So you connect very small blood vessels, and time is also a compromise there. Technique and skill level should be high. So you should choose a doctor who has high skill levels and has a track record of good surgeries and more experience place, because faster surgery is definitely required for moya bypass surgery. If you prolong the surgery, there is high risk of stroke developing during the surgery.
आफ्टर सर्जरी डाइट चार्ट में कोई चेंजेस होता है क्या?
No, we are advising these patients right from the point of diagnosis to remain well hydrated. They have to drink water and be hydrated at all times. So during surgery also we maintain this hydration. After surgery also we advise these patients to remain well hydrated until they reach a certain stage where these alternate blood vessels or channels of revascularization establish themselves and supply the brain adequately, that their risk of stroke is very minimum. It is at that time that we ignore further care for these patients, and they do very well. Usually they don't have any long-term risks.
अगर किसी का ये सर्जरी होता है उसके बाद वो नॉर्मल लाइफ जैसे लीड करते थे उसमें वापस आ सकते हैं?
Definitely yes. There are patients who have done very well in life. Some of my patients are pursuing PhD courses in US as well. One of the patients is right from this city, Kolkata. She's doing PhD in US.
Okay.
And almost 99% of these patients do well. The earlier the diagnosis, the better, because if we pick them up early and do the treatment, then these patients do very well. They lead very normal lives. They have to take a few precautions immediately after surgery for a few years after surgery, but later on they do very well and catch up with their normal lives.